Welcome back, everyone, to our Research Connect series. My name is Kendra Dupuy. I am a CDTRP trainee, and I will be facilitating today's webinar. I am also a master's student at Brock University, supervised by Vanessa as well. First, I would like to acknowledge that the CDTRP is hosted by the University of Alberta, which is located on Treaty 6 territory, a traditional gathering place for diverse Indigenous peoples, including the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Saulteaux, Anishinaabe, Inuit, and many others whose histories, languages, and cultures continue to influence our vibrant community. I encourage you all to write your land acknowledgement in the chat box as well. We would also like to acknowledge Estella's, whose generous support we could have not have been able to host these sessions without. So before we dive into the main content, I will just pass it over to Erica for some general CDTRP updates.
Thank you, Kendra. Today I have two announcements. Firstly, our innovation grant competition is officially open. CDTRP is offering $30,000 in seed funding for innovative pilot projects related to donation and transplantation. If you're interested, you have until April 1st to submit your application. A link will be in the chat box shortly. Secondly, CDTRP is still recruiting adult and pediatric organ and bone marrow transplant recipients, as well as family members or caregivers, to participate in a study which is evaluating the continued impact of COVID-19. If you are interested to learn more or to sign up, a link will also be in the chat. That's it. Back to you.
Thanks, Erica. Before I introduce the speaker, I just have a few housekeeping notes. So today's session is recorded and will be posted on the CDTRP website and YouTube channel. So during the presentation, please keep your mics off. If you have any questions or comments, just raise your hand using the raise hand button, or you can type it in the comment section. So I am now pleased to introduce our second presentation in our 5-part series, the annual scientific meeting, We Are Not Done Yet. Dr. Vanessa Silva is a PhD prepared nurse and former organ donation coordinator with over a decade of experience in organ donation and transplantation research. Her expertise lies in improving the quality of organ donation programs and structures globally. Currently an assistant professor at Brock University, Dr. Silva is leading groundbreaking research on burnout among donation coordinators, collaborating with Canadian Blood Services and international experts to address this critical issue. So I will now hand it over to you, Vanessa.
Thank you very much, Kendra Lee. Let me just take a moment to share my screen here. There you go. Classic question. Do you all see my screen?
You look good.
Awesome. Thank you. Thank you very much for the invitation to be here today. I really appreciate it. I'm always supportive of all endeavors from CDTRP. I'm a fan, you all know. And I'll start with some disclosures here and land acknowledgement. So I'm located in the St. Catharines region where Brock University is, and Brock University and I acknowledge the land in which we gather as the traditional territory of the Haudenosaunee and Anishinaabe peoples, many of whom continue to live and work here today. And this territory is covered by the Upper Canada Treaties, which is within the land protected by the Dish with One Spoon, One Pond Agreement. And today, this gathering place is home to many First Nations, Métis, and Inuit peoples. And acknowledging reminds us of our great standard of living. It is directly related to the resources and friendships of Indigenous people. Regarding my disclosures, I received funds from various sources and different parts of this projects that I'm going to be presenting today. One of the major contributors is Canadian Blood Services. We also had Children's Hospital of Eastern Ontario through the Channel Research Grant, and seed funds from Brock University as well. And I also have to disclose that I'm a co-founder of a research company that provides research services that is not related to my research program, which is called Vanami Research and Training. In this presentation, I'm going to go over a little bit of background because they understand that some of you may not be familiar with some terminologies or even organ donation specifically. So I want to have a baseline of a common language for all of us. And then I'll go over the BREAK program, which is the main study investigating burnout. The 3 phases, we're now in phase 3, so we'll go over each of the different phases with some outcomes of those phases being presented as well. And in part 2, I'm going to present some independent research that Dr. Amina Silva and I are leading that is related to education development for organ donation coordinators in Canada. Starting with the BREAK study, I just have to share a bit about the amazing team that I've been working in the past few years. Dr. Sunny Danani is a co-investigator with Dr. Amina Silva, and we also have Ken Lathernto, who was the project manager, but I believe we're going to be switching his role because he is now a director and Canadian Blood Services. So we're going to be having another project manager who probably will be Fiona. So we will just confirm that in a few days. And we had collaborators in the different projects throughout these years. And it has been amazing to work with such a generous team. So my understanding is that not all of you works with organ donation. So I thought I could talk a bit about the role of an organ donor coordinator and who that person usually is. So an organ donor, organ and tissue donation coordinator, or coordinator for short, is usually a person that is central to the donation process. So whenever there is a person that has a potential to be an organ donor, this individual will be coordinating all the processes that are related to that specific person. So they will be the key communicator throughout the process with the transplant teams, the recovery coordinators, the organ donation organizations, the hospital team, and the donor family. And they will make sure that everyone in the process has the necessary tools to be comfortable throughout the process, but also to have an effective process and an efficient process in which organs are retrieved with quality, while the donor family is also comforted throughout and supported very well during these processes. However, being in that situation entails a lot of stress and emotions day in, day out in the life of a coordinator. That means that, and we've seen this before, right? With COVID, especially, we saw a rise in the numbers of people with burnout and compassion fatigue. And that is also true to these individuals here, the organ donation coordinators. In terms of definitions for work-related issues, burnout is one of those definitions, which means a prolonged and excessive exposure to interpersonal, to work-related stressors. And compassion fatigue is another work-related issue that is very important, especially in this role, which is the constant exposure to others' suffering, and is also often called secondary trauma or vicarious trauma. And lastly, moral distress is another work-related issue in which the providers believe that they're doing something that is ethically or morally wrong, but there are some institutional constraints that will interfere with acting in the way they believe to be right. So let's say there are policies in place that will prevent them to act the way they believe it's correct. That being said, this constant exposure to grief, sadness, emotions, and stressors from the work, because as you can imagine, it's a very fast-paced environment to be working with, because you're trying to support the family, and you're also trying to maintain the organ's function, so it is a quality organ for someone that is in need afterwards. That pressure and the work and all the emotions may lead them to develop these work-related issues. And that sometimes is too much to coordinators. So we do see high turnover rates across the country and even internationally. And there's research saying that the job tenure of coordinators is less than 3 years. And the main issue of that is that when you have a short turnover rate like that, you have to hire a new coordinator, but the training takes a lot of time, effort, and also it costs a lot for organizations. And anecdotal information that we gathered with organizations is that it takes from 6 months to a year for coordinators to feel comfortable leading cases by themselves. So that's a lot of time for training coordinators. And this issue of burnout and compassion fatigue has been brought up to Canadian Blood Services by the past director, Amber Appleby, when she was a manager in one of the organ donation organizations in Canada, and had received reports from her employees saying that they were dying on the vine. So she wanted to help with that, along with David Cole as well at the time. And then I was brought up to the team to lead this national endeavor years and years ago. And with the group, we developed the BRIC program. And the aim of the BRIC program was to understand how burnout affected coordinators worldwide. And we also wanted to understand the extent of it in Canada. But not just burnout, but also compassion fatigue, resilience, moral distress, and other things that we measure with the study, to try and develop interventions to best support coordinators and the organ donation organizations as well. So we developed the BRIC research program, which is a 3-phase study. So we have 2 phases represented here, but we are in the phase 3 now with intervention. And along the years, we also had some additional projects because we did find very little on burnout and compassion fatigue among coordinators. So we did have to dig in deeper with additional projects, qualitative projects, and listening from the coordinators themselves, what issues they face during their days at work. And we completed phase 1, which was a scope and review of the literature. So if you point your camera here, it's going to take you to the actual research, the research article. And we identified with this study a research gap, because we could only find 29 articles that met the research criteria to be included. And those to not have like a lot of information regarding burnout and compassion fatigue. So what we found was that there was this scarcity of literature. We could find some burnout characteristics, compassion fatigue characteristics being described in the articles. However, authors did not use the actual terminology of burnout and compassion fatigue at the time. There was a lot of overlap with the definitions of compassion fatigue and burnouts, and when we were reviewing the articles, and we saw that we were on the right track with the BRIC study, because there wasn't a lot published at that time. So that led us to go to phase 2 of the BRIC, which was built in collaboration with the organ donation organizations. So to develop BRIC phase 2, Canadian Blood Services supported us to hold a working meeting with representatives from organ donation organizations, managers, and coordinators. So we had focus groups. We presented the results of the scope and review, and we were able to design a study that made sense, not only from the research perspective, but also from the operationalization perspective with the participants of the study. And that, along with my background as a coordinator, helped us to build this rapport with the organ donation organizations and organ donor coordinators and managers to have a very successful data collection for this study. If you point your camera to this QR code here, it will take you to 2 of the publications that we have for the study so far. We're also submitting other 2 articles in the next few months. So keep your eyes open for more results from the break study. This study then, designed with the support of the managers and coordinators, ended up being an explanatory sequential mixing method study. What that means, it means that we designed a quantitative phase, we collected the data of the quantitative phase, and that data informed the qualitative data collection and analysis. So we could complement the results of the survey. And then we would have a richer data to be compared and analyzed for interpretation later on. As I said, this was a very successful study. We were able to recruit 120 participants from 175 coordinators in Canada, which gives us almost 70% of participants in the study. And we had people joining from all provinces in Canada. And we found that the great majority of coordinators were women. And that was a bit expected because it is very common for the nursing professional to be predominantly women. And the great majority of coordinators are nurses. The mean age of coordinators was 41 years old and registered nurses. We also had some respiratory therapists, but it was minority. And unfortunately, 70% had reported willingness to leave their position at some point in their career. And 83% have been working more than a year in the position. In terms of substance use and abuse, we ask those questions because there is correlation in the literature of substance use and abuse when there is burnout installed. So we identified that coordinators reported using prescription drugs for non-medical reasons, for example, and also some reports of illicit drugs, but the great majority use alcohol, followed by marijuana and cigarette. In terms of increase of use of substance, there was an increase of 3 times from 2020 to 2021. Sorry, from 2019 to 2020, but it decreased from 2020 to 2021. And that coincided with COVID as well. So that may not be totally related with the profession, but with the environment and the situation we were living in at the time. In terms of the scales that we use to measure things in the study, we used the Burnout Maslach scale and in the areas of work life as well. So what the scales measure, they measure some aspects of burnout. So for the first graph here, we have emotional exhaustion, dispersonalization, and personal accomplishment measured. We had a high moderate result for emotional exhaustion, which is a bad result. For dispersonalization, which means when someone removes themselves from the situation and kind of stop feeling things, right? So they detach themselves from the situation. For dispersonalization, we did have a low rate, which is a good result, thank goodness. And then for personal accomplishment, which is a positive aspect, we had a high to moderate levels of personal accomplishment, which is a really good result. And it is a characteristic that is for this role. People usually have this personal accomplishment of being helping someone through donation. When we looked at areas of work life, we measure different things. We measure workload, control, so if they feel they are in control of situation, reward, if they feel they are being rewarded for what they do, community, fairness, and if they feel they're being treated fairly, and values, if they feel their values are being followed or not. So whenever we have a mismatch on this scale, it means a negative result. And we did have a mismatch, which is the number less than 3. for workload and for fairness. So when we have a mismatch in workload, usually
Attends,
it
Théra,
means
ton
that
étape de lavage, elle va être très très longue.
sorry.
Un peu de magie.
Hello, is there a question?
I
Can you
think
folks
you're
still
okay.
hear me?
I think
Okay, okay.
they
Sorry,
muted
I
now.
heard someone, I thought it was a question.
No, you're
Thank
good.
you. Yeah. So for workload, as I was saying, we had a mismatch, and it means that they have been working more than they can recover. And the definition for workload is that there's a critical point that occurs when people are unable to recover from those work demands, which is very bad. And for fairness, there was also a mismatch, and it means that they don't feel decisions are fair or treated with respect. Then we also had other scale that we used. The protocol was used, and we measure compassion satisfaction, which is a positive result, a positive measure. We also had another time measuring burnout and secondary traumatic stress, or a compassion fatigue, if you will. And for this result specifically, we did have a positive results for compassion satisfaction. Burnout was also in the moderate to high levels, and then secondary traumatic stress was also within the moderate levels. And we also decided to measure resilience with this scale right here, the CD risk. And even though we had coordinators reporting in the qualitative questions that they see themselves as very resilient people, the results from the scale show otherwise. They did not show as very resilient, which was very interesting to see, like their perceptions and the actual measures. COVID, we thought there would be a higher result for COVID, but it was a very low rate here, which is positive. So they did not have stress from COVID. And when we look at the qualitative data, that was explained because the great majority of coordinators, they were not working on active cases. So for those that were not working on active cases, they reported to have a little bit of a break from all the motions that goes on in the cases, and that helped them to decompress. And that's why we're saying there's a low result here, which is a positive result actually. And in terms of moral distress, there isn't an actual cutoff point used in this tool. So we do compare with other samples in the literature. And when we compare the scores from of OTDCs in this sample with critical care physicians, for example, in Canada, Canadian OTDCs is scored higher, which shows like there's a lot of moral distress going on, so they feel sometimes they don't have that flexibility in their work. So for qualitative data, we found different things. So we found work stressors. So they reported a lot of work stressors. And one coordinator mentioned that you get burnout because every case kind of wears you on in a different way. So you're completely drained and you need to sleep like for 5 days. And there were some reports on work-related issues as well. And they did not perceive that they were in burnout. So that was a common theme across the data, is that even though when they stopped to talk to us, they said, wow, I couldn't figure out what I was feeling, but now I understand that I had a time when I was burnout. And one coordinator mentioned this past few months has been hell. I didn't realize it until you gave me the option to step away from it. I am burnout and I need to walk away from this. So that was the feeling. So they were so ingrained in work that they couldn't even stop to think what they were feeling. And they feel that there's a lot of stress that goes on in terms of coordinating the processes and trying to support everyone. And also there was some comments in terms of management, and in terms of management, the not having actual practical experience to be in that position, and sometimes not understanding what they feel or what they go through during cases. But we also had satisfying aspects and teamwork highlighted as positive things. And obviously, all this data that I'm presenting here is data from 2021, 2022, and the results have been presented to organ donation organizations. They all received a report with the results, and there may be interventions that have been started in the different organ donation organizations. So this may not reflect the current scenario in terms of burnout and compassion fatigue and interventions to support coordinators. The next step for the study is to develop solutions, obviously, for the issue that we identified. And we also do that with the support of managers and OTDCs. So we did have another working meeting supported by Canadian Blood Services, in which we presented all this data, and we had focus groups, etc., to try and figure out what would be priorities for interventions from the front care professionals' lenses. And now we are in the process of developing, implementing, and then lastly, we're going to potentially measure the interventions. So from this data, we decided that we needed to investigate further because the main priorities identified were to work on coping mechanisms for coordinators, but also how to support education for coordinators. So we led, Dr. Amina Silva led a scoping review, a huge scoping review of the literature that I'm going to present here. On coping strategies, and I led another scoping review on educational approaches. And for this portion here on the left has been funded by Canadian Blood Services, and we are currently developing a coping strategy toolkit for coordinators in Canada that will be available for coordinators later this year. And we are also working on an educational program to be developed. It's called EDOT. And that is being developed with the seed funds from Brock University, and we're also applying for external funds as an independent endeavor. So I'm going to talk a bit about I'm cognizant of the time, so I will go over some of the things that we found for intervention on phase 3 for the toolkit development. This is the core team working on this project. Again, a project manager to be determined. And we found 4 main things with the data that we gathered: that we have coping strategies that are problem focused, emotion focused, meaning focused, and support seeking coping. And we have a bunch of data that we are organizing and a toolkit. So from the results of this review are being organized in a toolkit that will have 7 different chapters. So chapter 1 will be the actual introduction to all the work we've done with the BRIC study and why we're putting this toolkit together. And then chapter 2, problem solving. So we're going to focus on the different components that we found with the coping review, but this is supposed to be an interactive resource and independent chapters, so people don't have to go through every single chapter to find what they need at that moment in the different portions of the organ donation process and what they're feeling at the moment. And we also aim to have resources available for them to, in a click or a scan of QR code to access that may be free of charge for them. And so this is just the structure of the chapter that we're working. So we're going to include the 10 most prevalent coping strategies in each category. And then we're going to add quotes from the BRIC study as well, and reflective questions. And if there's any interventional studies that have been published since we did all the scoping review, we're going to add those as well. Now moving to the independent project the EDOT program. It's called Education and Donation of Organs for Transplants. It's a program to support coordinators' practice. And the core research team leading it is me and myself. And we also have Sunny as a co-investigator in this project so far. And we will potentially have other co-investigators moving forward. We have lots of collaborators from Federal University of São Paulo, Brock Universities, Canadian Association of Critical Care Nurses, the Canadian Nursing Association as well. Has been a great supporter of this work. Canadian Simulation, Alliance of Simulation in Canada, the CDTRP, obviously, and organ donation organizations across Canada are also supporting this work. And the study is also in 2 phases. As I mentioned, we had completed a scope and review of the literature, and the proof is already public. And we're working on some details on the proof. So this is not the end paper, but it is already public. If you guys want to point your cameras here, you can check the results of this scoping review that is helping us to develop this project. And we were interested in understanding the different training types that have been developed and different training for coordinators across the globe, and how they developed and how they planned the training strategy, what sorts of evaluation methods and results they use, what sorts of training types they had, like master's degree, diploma, or continuing education. What was the training focus, the teaching strategies, and the cost of funding, and the evaluation methods and results that they use. So we did have lots of pre and post tests. Organ donation and consent rates were also correlated with training results. There were some certifying exams being done, and research and questionnaires were also found in this study. In terms of next steps, we received funds from the Canadian Alliance of Nurse Educators using simulation. Now I can say it properly, for a pilot project in which we are developing a virtual simulation game. We are in the process of recruiting actors for filming, and this is going to be piloted with a sample of coordinators in Canada. We already received support from some provinces reviewing all the scripts for filming. So we still continue to do this very collaboratively with the provinces, because the end result, the end goal is to support what is important in clinical practice, and not just for publication or for research that is going to be, put on a drive and forgotten. So we truly want this to be a long-lasting project. We are also in the process of developing the curriculum of the EDOT program. So we already advanced on that as well. And we are currently applying for external funding. The last time we applied for the team grant with CIHR, we were ranked 19, and there were 15 applications funded. And the reviewers' comments were not negative at all. So we are very hopeful that this project is going to be funded pretty soon. I'd like to thank all the partners and funders and patient partners, collaborators, and organizations that have been part of all this work throughout these years. I'm really grateful for all of you, and I welcome any questions. Thank you.
Thank you so much, Vanessa, for that excellent presentation. I open the floor to any questions. Feel free to add them in the comment box or the chat box, or to just raise your hand, and then I can get those questions going. So just going to read the one from the chat here. So Vanessa, what scales did you use for your research?
Yeah, so I used the Maslach Burnout Inventory and the Areas of Work-Life survey. I also, let me share my screen here again so I can show you. Exactly. So we use the Burnout Maslach inventory for healthcare professionals. I'm not sharing my mind. Okay, there we go. The Maslach Burnout inventory and the areas of work like survey are one of the scales that I used. Then we use the protocol in which we have the compassion satisfaction, the burnout, and the secondary traumatic stress components. And then we use 3 other different scales to measure resilience, which is the CD risk, the COVID PSS, the COVID perceived stress scale. And we also use the MMDP, which is the, I can't remember. Oh boy, I blanked. But it's, if you Google MMDHP, you're going to find it as well. Okay, so I just blanked, sorry. Oh, measure of moral distress for healthcare professionals, sorry. There we go.
Thank you. Any other questions there or comments? Do you think COVID era would have implications to your data?
Yes, I think so, especially on the substance use and abuse questions, because the stress was higher, and people were tending to use more some substance to alleviate stress, right? So alcohol, etc., as I presented in the data. And also in terms of lowering their stress, because they were not working on active cases for some of the coordinators, but there were other coordinators that were redeployed to ICU, and for those, the stress was increased as they reported in qualitative responses. So we did have some impact in the COVID area for sure for the data analysis. Sure.
Have you noticed differences between?
Yes, thanks, Stephanie. I did notice differences. We present aggregate data, obviously, because we cannot identify anyone. This is a very sensitive topic. So we are protecting identity of all participants at all costs. But there is difference across the country, yes, because the programs are different. The number of people working in the programs is different. So there are provinces that have more coordinators working, they have larger programs. So they do have a bit more time to rest in between cases, where other provinces have like smaller programs, like 3 people working or 6 people working in the province, in the entire province. So they probably have a higher stress and little time to recover in between cases, which leads them to develop symptoms of burnout as well.
Perfect. Thank you. And then Kathy said in the chat, great research, huge, well done, Vanessa and team. Do you have any recommendations about training for coordinators / preparedness for the role? Given 3 years is the average life cycle of the role, and the time / cost taken to achieve competence to manage cases is 6 to 12 months.
Yes, thank you, Kathy, for your question. Yes, so that's the reason we're developing the EDOT program to provide a baseline training for coordinators across the country. So the idea is to support them in that sense, and alleviate a bit the burden from the provinces, so they can focus more on a specific training on the policies, procedures that are local to the organizations.
Right. And then do you have any psychological support systems in place for coordinators? And then just said apologies if it was missed.
No, you had not missed it. I did not mention, but and we asked this question, right, to coordinators if they had this, and we also collected data from the organization, so they do have their employee program with some counseling, and there are, at the time, I don't know how this is currently at each program, I'm sure they have further developed this across the country. But there's reports of oh my gosh, I blanked again. But there were reports of counseling, group therapy, and also peer support. So peer support was something that had been reported as one of their biggest tools to support each other because they understand what they go through. Right. So they understand the cases, they understand the stress, they understand the fast-paced scenario. However, that is a bit dangerous because through peer support, people can develop secondary traumatic stress. So that has to be done in a very controlled way. And I'm sure the provinces have supports in place for that to have like a group debriefing and everything so they can have that space as well.
So then another question from Kathy there. Could you please share the paper QR codes again? I just couldn't get to them fast enough.
Yeah, so I assume this is the
This is
one
all being
that you
recorded
want.
and posted on
Yep.
CDTRP's website and YouTube, so they will also be there.
Yeah, so this is from the phase 2. There's 2 papers there. And I will give a few seconds so we can move to the other ones. Then we have, this is the protocol, but it will give you the title for what is to come. We're publishing the final manuscript on Canadian Journal of Anesthesia, so it should be out pretty soon as well. And then we have the education review here that you can take a look at the proof. And there's one more. Let me see. And we also have the scoping review that supported the development of the BREAK study. Okay. Okay.
Perfect, thank you.
Let me know if
And
there was time enough. Oh, thanks, Erica. Erica took a screenshot and posted it
yeah,
here. Thank you,
Erica
Erica.
put it in chat as well.
Thank you.
Any other questions, comments? Okay. Well, thank you so much, Vanessa. This was great. If we don't have any more questions or comments, then I guess we can finish up here. So thank you for those who have provided questions and comments throughout today's presentation. Dr. Vanessa Silva, on behalf of CDTRP, thank you again for presenting. If anybody does have any additional questions, comments, or suggested topic and speakers, you can contact Erica Croft at ekcroft@cdtrp.ca. We'll throw it in the chat as well. But thank you so much, everyone, and enjoy the rest of your day.